Emma, let's pop into a feeder room, shall we?
Here we have Emma and Jessica. Nipple to nose, chin in first, hand across her shoulder and just bring her in. You can see that chin is indenting into the breast tissue. Emma needs to make sure that she sits with her back straight, feet comfortable on the floor, and if she can't quite reach the floor, then an old box file or something just to bring her feet up a little bit so she's feet are flat, she's not balancing on her toes. The baby should be in a straight line, head, neck, shoulders and bottom, pelvis in a straight line, and we can see here that Jessica is. When the baby first goes on, the baby will need to pull and stretch the nipple right to the back of his or her mouth, so it's beyond the junction of the hard and soft palate. And a lot of women experience fleeting pain at that point, which is very normal, but it should go perhaps within half a minute. If it continues, then there's something wrong with the attachment, and then mum should have the confidence to take the baby off and then let her go. Just bring her in just a little bit closer, Emma, just a little bit closer to you. That's it. Just a little bit deeper into the breast tissue. There's no risk of her sliding off and ending up on the nipple, which is going to give you pain and discomfort. It's all about positioning and attachment. Positioning is what you do with your body to make sure that you're comfortable bringing the baby in. And the attachment is how you bring the baby in for a breastfeed. Baby should be drinking and swallowing. Cheeks should be nice and rounded. Bottom lip will be open, and there'll be more areola shown by the top lip compared to the bottom lip. Breast milk obviously contains a lot of antibodies, and it protects the baby for however long the mother is breastfeeding and beyond that. And colostrum is really rich, full of antibodies, which is great for the baby's immune system. The baby has a very small stomach, about the size of a marble or just slightly bigger, so it will stretch gradually over the next couple of days, so it doesn't need huge volumes. Round about day 2 or day 3, a mum will experience a slight sort of fullness of the breast, a bit of tingling, feel slightly hard, a bit warmer. She will know that the milk has increased in yield. And she may well see that her baby feeds slightly different as well, perhaps drinks a little bit more. Engorgement generally means that there's something wrong with the attachment. There's a difference between engorgement and fullness. And full breast is when the milk is increasing in volume, and engorgement if the baby's not taking all of the milk off that they need to take off to make the breast comfortable. Mastitis is an inflammation of the breast tissue, and it means that the milk has got a little bit stagnant into the breast, and it causes a local inflammation. Sometimes it can come on very, very quickly. The mum can feel well 1 minute and totally flu-like and rubbish the next minute. Persist and you feel unwell, then you must seek medical advice. The candida organism responsible for thrush likes a nice, warm, moist environment, which the breast and the baby's mouth provides. Thrush of the breast is quite common, and a lot of women with thrush describe soreness on the breast tissue itself, and it's there all the time. It's not just for feeding, so that's how we know that it's nothing to do with the attachment, but it might possibly be thrush. You can see that Jessica is stretching and ready to come off the breast tissue spontaneously. Brilliant. That was a typical sort of baby, having a nice feed, being very calm, and then fidgeting a little bit towards the end of the feed, and then stretching and then coming off. So she's self-detached and saying very clearly, I've had what I want from this breast at this particular time. Thank you very much, Mum.